that point in time, I had some loved ones that were facing that, as well as I would come to work with those needs in my professional role. And I've just found that it's something that's really important to talk about. So this is called The Long Road Home, and it has to do with the impact of memory and communication. So if we don't get through everything or you have questions afterwards, please feel free to come and speak with me. I'm very much open to that. Again, I'm an adjunct faculty member at the University of Denver Graduate School of Social Work in Denver. And I've had the honor of doing that now for about 5 years. I've also worked in hospice care, in direct mental health. Oh, there are the fancy learning objectives. Okay, so we're going to look at types of dementia and how this impacts individuals and families. We're also going to explore the concept of what's called anticipatory grief. Okay, so to anticipate something. And discover communication technique. So I like to start with this slide. So what if, right, we're developing a vision, right? So come on in. To accomplish great things, we must not only act, but we must also dream. Not only plan, but also believe. Right? And this is something that I try and remind myself of in the work that I do. That I have to leave room to dream about what programs, what initiatives, how can we connect with people who are in need of this information and this support. Right? So you may ask yourself, depending upon your role, what is dementia? Okay. The Alzheimer's Association, I will tell you right now, is an absolutely phenomenal resource. Okay. I worked for a short time as a helpline coordinator there, and I did an internship rotation there as well. So we use the term dementia like an umbrella term. Okay. So it's a general term for decline in mental abilities that may be severe enough to interfere with activities of daily life. Okay? So what you may see is that somebody may be experiencing changes in their memory, and that it may be something that's impacting their daily living. Okay? And I know words like dementia or Alzheimer's or things like that can be really scary, right? And so part of what my role is as an educator and as a professional is to help people understand how do we preserve the dignity and worth of individuals who are experiencing memory changes. So as you all heard in the earlier session, I've been impacted both professionally and personally in some of these areas, and so it's part of the reason I'm so passionate about it. So Alzheimer's disease is what you're going to hear about most often. That's the term that people hear most frequently. So as I said before, dementia is like an umbrella term, and then different types of memory differences will fall under that. Alzheimer's is one of them. So for example, you may see Alzheimer's, you may see Parkinsonian-related memory changes, vascular dementia, those types of things. So Alzheimer's is the type of dementia that I think is probably most often talked about and that people hear the most often. So it's a type of dementia that can cause challenges with memory, thinking, and behavior. Okay? Symptoms in Alzheimer's usually tend to develop slowly and get worse over time to a point that sometimes it impacts daily activities. Alzheimer's is what's called the most common form of dementia. Okay? And if you want to get down to the technical nitty-gritty, it has to do with changes in plaques and tangles in the brain. Okay? But the most important thing that we're going to talk about is how do we help support somebody, a loved one, someone that we're working with in a professional capacity, as they experience these changes. right? So there are different stages of Alzheimer's, and all of this information gets updated regularly. I would encourage you to look at the Alzheimer's Association website. You'll see a lot of my slides reference them as a resource. So in Alzheimer's there can be, and the stages have been discussed about, right, how clear-cut is this. Mild Alzheimer's disease, or what's called early stage, moderate Alzheimer's, or kind of the middle stage, and then significant Alzheimer's, that's the later stage. Okay? So some signs and symptoms that you might notice are listed up here on the PowerPoint. So we talk about, because people become very worried when it comes to their cognition, their thinking, and their memory. Right? It's something that can be very stressful. And so sometimes people will say, I think I have Alzheimer's. I think I have dementia. I don't know what to do. Where do I go? What do I look for? Right? And we'll talk about some of the resources available for that. So sometimes people will say, oh, well, you know, that's just part of getting old, right? Part of my challenge is, how do we look at the culture around us and say, when is it okay to say, yes, people may have changes as they age, but what is our role in preserving their dignity, their integrity, and their worth, right? So, for example, here you might see that there's some, when we take a closer look, some things that may differentiate if somebody is experiencing Alzheimer's versus, you know, age changes that could be linked to age, or could be linked to a medical condition, right? So sometimes people may have trouble managing a budget, right? I have trouble managing a budget sometimes, right? So some people will say, oh my gosh, I missed a payment, you know, maybe I have Alzheimer's, maybe I have dementia. It isn't necessarily that initially if you've missed a one-time payment. If you're seeing changes that are happening with loved ones or with providers or within yourself, it's something to take a look at and to perhaps discuss with your doctor. And there are lots of tips too on how to approach those conversations. So I always tell people, if you have any concerns about your memory, okay, if you need resources about how to address memory challenges, memory changes, the Alzheimer's Association has information available 24 hours a day, 7 days a week. They have a toll-free helpline that you can call, and they will connect you with somebody who can help you get information and resources. Everything from some of the communication techniques that we're talking about here to research and new developments and studies surrounding memory changes, right? And so I always encourage people to take a look at that. I encourage people to program it into their phone, right? I haven't been at the Alzheimer's Association in a number of years, but I still have it in my phone, and I still regularly provide that information to loved ones, to family, friends, neighbors, or people that I'm working with. So families may come together, or they may experience some conflict, or sometimes a little bit of both. I can't imagine. Has anyone in here ever experienced any kind of family conflict ever? Okay. I was going to say, unless everyone in this room, right, has somehow managed to get through a family life without any bumps and challenges, I would be amazed, right? So sometimes people come together. They may experience conflict. It could be both, right? And so part of my role is helping to support people through that process. So we talk about sometimes domains of suffering that may happen. things that people might experience. So you might feel things, like as we talked about this morning as a caregiver, right? You might feel something physical. You might be having more illnesses or noticing things like chronic pain, okay? Emotional challenges. You guys saw me this morning, right? I mean, I think I I tried to stay composed. But when you're talking about something as personal and as private and important as caregiving, particularly with somebody who is facing a memory challenge, it can impact our emotions, right? There can be social components. So often people who are caregiving or individuals as they age face increased isolation. So they may not have as much social interaction, which is something that can be really difficult, right? Spiritual, right? Whatever that means to you or doesn't mean to you. It's just something to know that people may experience some challenges or some form of, form of suffering on a spiritual level. Sometimes there are questions surrounding, why is this happening to me, right? Or why is my loved one dealing with this? What does this mean, right? Did I not do things the way I was supposed to? Sometimes people can turn that blame inwards, and they can get really angry at themselves as well. And then the big fancy word of existential, right? Existential is a big long word that means that you might be suffering on the level of looking at things in a large scale. Like, what do things mean anymore? Like, why is this happening? Why am I experiencing these things? What am I supposed to do? What does this mean for the future, of our country? Things like that, where you start to examine things on a large systems scale. Part of the reason that I'm so passionate about providing this kind of education, and part of the reason that I have taught at DU, is because I want to help people to have knowledge and support that the reality is our population is aging at a rate that we have not seen before, right? And what I want, and people who are invested in the well-being of individuals, is for community members, families, neighbors, professionals to be educated about what that means. Because this is a very real reality that we're going to be facing. And so part of what I enjoy about teaching is being able to share that information. And not only do I share the information, I learn from my students every time I go to class. They'll say, have you heard about this? I brought this article in, right? And I learn from everyone that I see at a conference, somebody who comes to me with an experience or has a new resource. So part of what we want to talk about in something that's unique in dementia, right, as memory changes over time, is that there can be an experience of what's called anticipatory grief. So because part of my work has been in hospice and palliative care, this was something that I would look at a lot with clients, with families. I do that in my role as a mental health provider, as an educator. There's a fabulous book, which then later became a movie, called Still Alice. Have any of you seen that or read it? Okay. It's called Still Alice.
Still?
Mm-hmm. Yeah. Like I'm Still Alice. And it is a fictional piece of work, but it's based on and was written by a woman who is phenomenally knowledgeable. And one of the things that I look at is anticipatory grief, so anticipating changes. Right? There's a passage from that book that says, I am so sorry that I have this. She's talking about her experiences with memory loss and her early onset journey with that. I am so sorry that I have this. I can't stand the thought of how much worse this is going to get. I can't stand the thought of looking at you someday, this face that I love, and not knowing who you are. She traced the outline of his jaw and chin and the creases of his sorely out-of-practice laugh lines with her hands. She wiped the sweat from his forehead and the tears from his eyes. I can barely breathe when I think about it, but we have to think about it. I don't know how much longer I have to know you. We need to talk about what's going to happen. And this is in a conversation with her partner, with her husband. And it says, he tipped his glass back, swallowed until there was nothing left, and then sucked a little more from the ice. Then he looked at her with a scared and profound sorrow in his eyes that she'd never seen there before. And his reply was, I don't know if I can. Right? This can be a very common experience. And I know that the stuff that we talk about can be heavy, right? But part of my role is to educate people and to support people in having those hard conversations. That's why, remember how I said in the first presentation, in my medical durable power of attorney, right? So when I say this is the person who I want to make healthcare decisions for me, if I am unable to express my wishes, it is very, very, very specific, right? All the way down to, I shared with you all that I have in there that if I'm unable to express my wishes, I am to be given, offered, or fed dark chocolate every day until I die, unless I refuse it, right? I have in there that if I can't express my wishes, where would I like my care to take place? I specify in there that wherever I go, I want my animals to be able to be present, to come visit me, right? If they're not able to live with me. I drill down specifically on the things that I want because of these things, because of that anticipatory grief, right? Because of those changes that sometimes can happen. Because we never know, right? You know, when I was younger, I thought, I don't need to have this in place, right? And then I started working in hospice and palliative care, and I started working with people, and I said, this is really important. And then the more experience I gained, the more things changed in my document. You know, and part of it is that anticipatory grief process and memory changes in particular, where we're grieving something. So, has anyone ever heard Alzheimer's or dementia referred to as the long goodbye? Okay. Yeah. So, with anticipatory grief, there are things that might happen, right? The long goodbye. So, saying goodbye again and again to the person you once knew, right? And that can be really hard. Sometimes, remembering when our loved one does not. Sometimes people might make painful comments, or there may be difficult situations that our loved one doesn't remember, right? But we remember, right, as a caregiver, as a loved one, and it's hard to process that. And then cultural experiences and trauma. This is something I cannot emphasize enough. It is incredibly important to know when you are working with individuals of any age. But as people's memories change, sometimes they revert back to a different time in their life. If they've experienced any kind of trauma on a personal level or on a cultural level, you know, if they were in the Holocaust, if they were in the Japanese internment camps, if they had a personal trauma in their own history, some of those things might come back up, right? And so what we want to do is we want to honor the person at each phase of their life and knowing how we can best help to meet their needs. I love this picture. Right? So we're going to talk about, and I know some of you can't see, so I'm going to try and dance around this way for a minute. Communication techniques, right? So it's an older woman, and she's sitting in a wheelchair like this, okay? And what she sees on the wall right, is like a ballerina. People might look at her and think, that's not what I see, right? But getting to know somebody, getting to know how they view themselves, what is important to them, what matters, makes a huge difference. So how others see you is not important. How you see yourself means everything, right? So what if I came to this woman and I said, you know, I was dismissive. I said, well, you're not a ballerina. Or, well, you can't dance anymore. Right? How hurtful. How truly, deeply hurtful would that be? Because this is how she sees herself, right? And it's our role to help validate that. So there's a poem that I wrote back in 2012 as I was kind of going through my own process of working with people with memory differences and also serving as a personal caregiver to my loved ones. And it's called Mist. So this focuses on communication. You look at me as if we knew each other once. Were we best friends, family, or colleagues? You see me, but do not fully know me. It is as if you are mist upon the water. You can see me, but cannot touch the real me. I cannot remember. Wasn't this person just a little girl? Didn't I give you warm cookies and cold milk last week? And now they say that you are an adult and have a family of your own. I do not fully understand, so I smile politely and nod my head. I look at you cautiously sometimes and wonder if you are telling me the truth. Please don't embarrass me. When you ask me, don't you remember, it makes me feel a little flicker of shame inside. I am an adult, and I don't want to be chastised like a child. Please just love me and accept me for who I am today. Let's just have this moment together where you join me wherever I am. And so what that means to me, and it can be hard, right? I've had training in this, I've gone to school for this, and I still have moments where it's challenging. It can be hard, right? It can push us. It can push our emotions. It can push our boundaries, right? So the things that I have learned that have been most helpful in communication, right? Because with dementia, people may remember things differently than you do, right? So I usually give the example of, let's say, I hold up this juice, okay? And Wendy, will you tell me what color or what kind of juice is this?
It's grape juice.
No, it's apple juice. Okay.
It's apple juice? What color is it?
Oh, it's purple. Oh, okay.
Okay.
Now we could go back and forth. Wendy and I could argue back and forth about what type of juice is this. Mm-hmm. Is it Grapple? Grapple. Grapple! We're both right!
Compromise.
Actually, that's funny. That's the whole point, is that we are both right in our experience, so we'll call it Grapple, right? I may see the juice as apple. Wendy may see it as grape, right? But at the end of the day, does it really matter? Right. Because we're both seeing things through our own lens of the world. And it doesn't make one of us right or wrong, or good or bad. Sometimes it means that we make grapple, right? We compromise. Even when we didn't know that we were going to. I promise, that wasn't even rehearsed. So letting the person know who has a memory difference that you are listening, right? It's very important whenever you talk with people to let them know that you're paying attention, right? Sometimes when somebody has a memory difference, we may look distracted. We may not be engaging with them fully. And trust me, people will pick up on this, right? Provide extra time and don't interrupt, right? So if I'm working with somebody, or if I have a loved one, and I ask them a question, like, what did you have for breakfast? Right? Then they may pause, and I may give them extra time. Or if I see that it's causing them distress or anxiety, I may flip that question. And I might say, oh, it sounds like they had a good breakfast this morning. You know? What did you like? Right? So we're providing extra time and not interrupting, because I could easily say, give that space and then say, well, I looked at the breakfast menu, and no, you did not have oatmeals and bananas. You had pancakes and, strawberries, right? Avoid criticizing, correcting, and arguing. When our loved one, when someone we care about, when somebody that we've worked with for a long time has memory changes, it can be hard, right? To not criticize, correct, or to argue. Because for many of us, right, as well as the individual experiencing the memory changes, we don't want this to be part of the current reality, right? But at the end of the day, like we talked about, if somebody came up and they identify, as the ballerina in the chair, and, I come up and I pull up a chair and I say, well, how are you doing? Oh, great. Oh, you look beautiful. Right? Oh, I'm a ballerina. Right? I'm not going to say, you're not a ballerina. Right? I'm going to say, tell me more about that. Or wow. Or beautiful. Right? We focus on the feeling and not the facts. Right? So we focus on what emotion is present. If the facts aren't all right, like all in the correct sequence, that's okay. We focus on those feelings. Use short, simple sentences. I struggle with this a little bit. I can't imagine. None of you know that I'm a talker, right? I'm not a talker. Come from a family that communicates a lot, right? I'm the youngest of 8 children. So I had to learn how to use short, simple sentences, right? I would be a question stacker. So I would come and I would say, hi, Wendy, how are you doing? Did you have a great breakfast? What's going on? Like, that's just my family or my personal style of communicating. So I had to learn to slow it down, right? And to use shorter sentences. Again, avoiding quizzing. And this I cannot emphasize enough for anyone. Whatever their diagnosis may be, whether they have a diagnosis or not, do not talk about a person as if they don't exist. Right? That's incredibly hurtful. And sometimes that happens with individuals who have memory loss. When I would do care conferences, I know sometimes it would drive people crazy, but I would take the time and I would turn to the person and I would say, Wendy, we're going to talk about how to make you comfortable, right? And then I would turn back and I would engage with the team and then I would check back in, right? We're talking about medicine. Even if that person couldn't communicate back with me, because how infuriating and how disrespectful to be talked about like you don't even exist, right? That person exists, and not only do they exist, they matter. So remembering the past and honoring the future. So I always tell people, keeping in mind that a person with memory impairment or memory challenges has both a past and a future, right? We meet people at a snapshot in their life. And sometimes it's easy to make assumptions about that. So wanting to know that the person has a past, right? And they have a future. Their past is important, right? Maybe that person had, they grew up with horses, for example, right? They were a ranch hand, right? As a professional, I want to know that. I want to know what that person did for work. I want to know what was their family structure like. I want to know what their favorite foods are. I want to honor and respect them because everyone comes with their own story. Engage in storytelling and reminiscing when appropriate. Avoiding correcting and focusing on facts, right? So this is something that I learned not only professionally, but through my personal journey, is that a lot of times what I did with clients or with my loved ones, we would reminisce, right? And if my loved one said to me that, you know, they had a child that was 5 years old and they were talking about my mother, right? And I know that my mom is not 5, right? At least I don't think so, because, you know, then I would have to be like really, really young. So I'd have to put on my disguise of youth, right? But what I'm going to focus on is that, what does that mean to that person? What's important about that? You know, so I'm going to engage in storytelling. Oh, you have a 5-year-old? What's your daughter's name? What do you like to do together, right? And not in a demeaning tone, not in a way that makes people feel minimized, right? Or the big term is infantilized, treating an adult like they're a child. Nothing frustrates me more than watching that happen, right? And then exploring alternative ways of communicating. So there might be things like arts and crafts, scrapbooks, music, things like that. So sometimes when somebody's memory impairment has progressed to a point that their communication decreases, I look for other avenues of how I can communicate. A lot of times that incorporates different types of things, like music, scrapbooks, looking at things that are tactile. So like I used to carry, I would actually, for individuals that I had that were primarily nonverbal, they weren't able to communicate back and forth, I would research and look at what are things that they have liked and enjoyed. What do I know from family members about things that are important? And then I might go to the dollar store, right? And look for things that were tactile, like a stuffed animal, right? Of a horse, because that person grew up with horses. Or I might bring, something else that incorporates those 5 senses. So how do I explore that communication? And how do I enhance it? So sometimes we might see behavioral changes that happen when somebody's memory changes. So there may be things like irritability, anxiety, depression. There can be things like agitation or even sometimes aggression. Physical or verbal outbursts. Restlessness, pacing, shredding things like shredding a napkin, stuff like that. Sometimes people have hallucinations, so seeing or feeling things that aren't there in our perspective. Not that we're invalidating what they're experiencing, because for them it is very real. Right? That was the chime.
It's not pretty chimes.
And sometimes there may be sleep disturbances as well. So the biggest thing that I want to talk about with behavior changes is that when you see behaviors develop, most likely that behavior is communicating a need, right? So with my loved ones, right, if I would get a call and my, mom would share with me that my loved one was more irritable and she had dementia, I would say, what's the padding like on her wheelchair, right? Is she comfortable? When was the last time that she had breakthrough pain medication, right? What is the need? Do they need to use a restroom? Are they hungry? Avoid arguing, again. Redirecting attention. Sometimes it can be helpful if somebody is getting amped up or they're having behavioral experiences, redirecting that to a more pleasurable activity, if you're able to. Some people, right, have in care communities, I think it's pretty phenomenal, or even in the home. certain jobs that they really like to do, right? Let's say that somebody was a parent and something that they did a lot of times was fold laundry, right? And this is a common, enjoyable experience for that person. So that you might find people who are folding laundry. You might find people who are wrapping silverware, if it's safe for them to do so. Redirecting that attention to something that somebody enjoys, right? And then keeping a calm environment. So create a space, if you can, where there's not too much stimulation, because sometimes, and that can be hard to do on occasion, but sometimes people can become overwhelmed, right? There's too much going on. Maybe the person is agitated because there's too much noise, right? So we want to allow rest between stimulating events as much as possible. Provide a security or comfort object. So for example, one of my loved ones had a stuffed bear that they loved. They loved the feel, they loved the touch, they loved the softness. They identified this bear as actually an animal that they had had in the past, right? And to them, you know, this bear, Cubby was alive, right? Cubby had needs, you know. Look at Cubby, right? Or, you know, I don't know, do you think Cubby's comfortable? Well, let's double check, you know, and kind of tuck him in, right? Not because I wanted to infantilize, not because I wanted to talk down to the person, but because it mattered, right? For them, that was their comfort object. Looking for reasons behind each behavior. Consulting a physician to identify any causes related to medications or illness can be really important. Caring for somebody who has memory challenges in itself is a complex process. So one of the things that we want to look at is if we're seeing behaviors increasing, right? Is it possible that somebody has a urinary tract infection? Is it possible that somebody is experiencing an illness and they aren't feeling well, right? And it's very, very helpful if you have a physician who is knowledgeable about the components of dementia and or Alzheimer's and the physical things that can come along with that. And then explore various solutions. So one thing that I would do is I would keep a list. What's worked well? What hasn't worked so well, right? Because I'm going to learn from both experiences. And it's going to be different with each person, right? So some of them is knowing those behavioral cues too, that if I'm working with somebody and they're becoming upset, you know, I want to give them space and distance. And always, number one, I want to show respect. Because for me, at least, that was a cultural norm that is part of my family, that you are to treat other people with respect. You are to treat them with dignity. Because people are important, right? And so I want to keep a list of what's worked well and what hasn't. So again, I want you guys to remember, you're not alone in this journey. There are amazing resources that can help you to have that support. They have fantastic handouts, information, things you can print about my loved one or the person I'm working with is experiencing, you know, X, Y, or Z behavior. What could that mean? What do I try? What do I look at? Right? And coming back to it again and again and revisiting it. Because each approach is going to be different. And each thing is going to be unique. And each person is going to respond in their own way. And it's something that as professionals and as personal caregivers that we have to be flexible around. And sometimes that can be really challenging, right? But at the end of the day, part of our job is to make sure that we are providing somebody with comfort and dignity, and also addressing concerns around safety. There's a very fine balance between what we call in the social work world individuals' right to self-determination, right? Their right to make their own choices. And then balancing that with safety and well-being. And how do we walk that fine line, right? How do we look at that? And how do we help people have more choices? How do we help people to feel more empowered in a situation that can feel very, very powerless? Okay. So I put this on there because that's a forget-me-not. I love that flower. I know for me it has been an honor and a pleasure providing care both in a personal and a professional capacity, and that it can be really difficult. Does anyone have questions that you want to ask? If you don't want to hear in this setting, you certainly don't have to. You can come and speak with me privately as well. Anybody ever run into a challenge in communication or caregiving? I see some
behind
heads.
you.
On a daily basis.
Hello! I'm so sorry. I have my back to you.
I slept.
Okay. Yeah. Yeah.
I guess one thing I want to say is, well, two things. One is I've been caregiving for a while, and it always seems like there's always one person in the family that is a major caregiver, and the rest of the siblings just go, oh, you're doing a great job, just, keep going.
I'm not doing a good job.
Right.
But it's just amazing how it might just be you, and you have to get over that it's just you. And
Right.
you just move forward on that.
Yeah.
And the second thing is you had a screen that talked about saying goodbye over and over again, and the person that has dementia, and that's right now it's my dad, and he knows me, but he also knows he's forgetting things, but also as the caregiver, and he's at Vista Mesa, so it's not every day like it used to be, but when you're a caregiver, you are grieving all the time because you're losing that person bit by bit. It's not like when somebody has a car accident and is gone and you have this grief period. It's like
Yes.
forever, and you really need to take care of yourself. I can't.
Thank you for sharing that. I think that that is really important, right? That sometimes in family dynamics, there might be like, I am the caregiver, right? And then other family members that are kind of ancillary or, like side support, or maybe you're not getting as much support from them as you would like. So sometimes having those tough conversations and navigating those dynamics, I know as a social worker, that's something that I have come up against again and again and again, is how do families come together? How do families pull apart? Who is considered family, right? It may not be by blood. It may be, a neighbor or a friend, right? And then I think you brought an excellent point as well about going through that grieving process of saying goodbye again and again to a person that you know and that you care about. And absolutely the importance of taking care of yourself through that process. It's incredibly important.
Was there another question on this?
I was going to say, I think I saw...
I find the hardest thing is to deal with my own getting older and problems associated with that, and then having to handle the onset of dementia of someone you love. How do you keep dealing with both at the same time?
Thank you for sharing that.
How?
It's really hard. So part of what, and I would love if we could touch base too after the presentation if you'd like. Part of what we look at is how do we balance as we are aging and facing our own health challenges and providing support as a caregiver, right? It's a very hard balance. And that's part of what I work with as, you know, as a woman who's coming, you know, into her own and learning about and talking with my parents, my mom, with my grandparents, with my loved ones about what are your experiences as you're aging, right? What are things that I need to know? What are things that I need to keep in mind? And I think one of the things that I cannot emphasize enough is that if you are experiencing changes related to your own health or wellness, and you are also a caregiver, right? If you are able to reach out for some support, right? That may not look, you know, totally formal. It might not be somebody who comes in from an agency every single day. It might be, right? But part of the thing is that if we're going to care for other people, we also have to take care of ourselves. Because we can't lift somebody else up when we're also reaching for ourselves. Right? And the strength and the courage that it takes to, you know, talk about that difficult emotional reality of I am facing changes myself and I'm also a caregiver. All of us in this room, we would be amazed to see how many people are aging or facing their own healthcare challenges and also being a caregiver, right? And where is that support? Where do I go? Who do I talk to? Right? Very important questions. I think speaking with your physician, reaching out possibly to somebody who's in mental health or who can help lend that support. It can be little things that you do for yourself throughout the day when you can make time, and I would love to talk with you more about that because it's hard. It is really, really hard. And I thank you so much for sharing that because I think it's so important, that balance. Right? Are there other questions?
You have not addressed death with dignity.
Ah,
How do you have the discussion with the person that says, don't let me go like my mother went?
mm-hmm. So that is an excellent question.
And it's on the ballot.
Mm-hmm. So the Death with Dignity Act is something that has come up in a lot of discussions. It can be something that people are very divided on, right? That having worked in hospice and palliative care, every single day that I worked that job was, how do I help somebody have dignity and worth and comfort and peace of mind, right? Now, some people, right, and I'm not here to say which way you should vote, right? I do encourage you to be informed about the issue. I would actually, this sounds kind of strange, but I would have conversations with people when I worked in hospice about what would a perfect death look like to you, right? And I would broach that gently after we had developed a relationship. And that's a hard question to ask. And I might phrase it differently depending upon the person. But I would say, what, and I'd say, what do you mean? I'd say, who would you want there? Or would you want to be by yourself? Do you want music? If so, what would that be? Right? What is important to you as you near the end of your life? Do you want somebody to hold your hand, right? Do you want that touch and that comfort? Or do you not want that? Right? What are those things that are important to you? And it sounds strange, but I would literally say, do you have a favorite scent? Like, do you like lavender or peppermint or things like that? Who do you want at your bedside? What choices can I help you feel empowered to make? And as that person was coming toward the end of their life, I would actually put an alert in our system that said, this is what this person has expressed that they want. And the Death with Dignity component, it comes with a lot of challenges and languages, and there are very divided opinions about that. But I encourage people, and I think you've done a great job, and thank you for bringing it up, because there is a lot of discussion about what does that, proposed legislation mean? How do I address it? Right? How do I feel about it personally? And what does that look like? That's why I encourage people to have those advanced conversations.
So I come from California
Oh,
and Washington, where,
okay.
where this law exists. So I'm going to be impartial. One aspect that's very important is that the only way that law, somebody can utilize that, first of all, it has to be determined by the person who has the illness, the terminal illness. There are a lot of safeguards there, but you have to be completely cognitively intact.
But we were talking about saying goodbye. I'm from Oregon.
Oh,
okay.
I was going to say, atta girl.
We were talking about apologizing for, I'm sorry that this is happening. At that point, you're still cognizant. At that point, you're supposed to have the conversation. And I'm sorry, you missed the point. It's the conversation, the decision that's the tough one. Not, do you want lavender or rose smell as you drink your concoction. And of course, we know that we don't need a law to allow that to happen. Heaven's Gate people told us how to do it on our own. But do you do it, and at what point do you do it? Because when you're discussing dementia, it needs to be done while the person is still fully cognizant of what's going on.
And that's why I think, and thank you for clarifying as well, why it is so important. And part of my job for 10 years has been talking with people about those hard choices. What interventions do they want? What do they not want? Do you want to be resuscitated? Do you not want to be resuscitated? Do you want to be on a ventilator? Do you not want to be on a ventilator? Right? I have walked people through that process of describing what medical procedures may take place and what may be the outcome of that, right? And those hard conversations are incredibly important, and I absolutely agree with you. I think that in any circumstance, it's very, very important to have that conversation, to express what your wishes are, to get them written down on paper, right, before something changes, and to have that discussion. And it can be very difficult to approach, right? But it's very important. It does need to be done. There is an incredible resource that I can also give you guys about the Conversation Project, which talks about how do we broach those hard conversations. And we could do a whole separate panel and a whole different breakout session if we had time today about what are people's right to choose, how do we honor that, where do things change, right? But at the end of the day, so for me, it might be important that on my medical durable power of attorney that it says, if I cannot express my healthcare wishes and the doctors have determined that it is not likely that I will regain my abilities, these are the steps that I will follow. For me, because I have had the experience of watching people die, because I have lived that life as a professional and as a personal person, in my personal life, for me, some of those small details matter. Right? For some people, they don't. And that's why I encourage people to have that conversation